Ali has been visiting Lynn, a cranial visceral osteopath, throughout her pregnancy. She has 18 weeks to go till the birth of her baby. This will be Ali's second baby.
I now know what to expect, and I want to try and help my body, if you like, give birth in a very easy way, or you know, just a more beneficial way really for post-birth recovery.
I'm just going to get my hands in place. So we're going to have a go first, keeping your heels on the floor.
Okay.
So just slowly squat down.
Can I hold on to the bed?
You can hold onto the bed when you need to.
Lynn is working to ensure that Ali's birth experience is the best it can be.
What I'm doing is making space for the baby, making sure that the mother's comfortable. You turn your back and face towards the door. Always taking care of baby. But to make sure that the spine's in good alignment, that as the pregnancy progresses, they're going to take a different stance because they've got this weight in front of them. So to really find for each mother where she needs to stand, where her tensions are, release the tensions through the spine and muscular tensions. Okay, that's a bit tight in there.
Lynn spends time assessing how much movement Ali has in her spine and pelvis as pregnancy relaxes the ligaments throughout the body, and she will make minor adjustments according to what she finds.
The impression is moving quite well, except the lower spine is just tight at brow. Look straight forwards. I'll get you to do some muscle testing now. We'll get to exercise.
Uh-oh.
Uh-oh. So push both arms towards each other.
In addition to osteopathy, Lynn practices kinesiology, a system which uses muscle testing techniques to assess areas of the body that may not be functioning well.
You just had a cold or something?
Yeah, I have, yeah.
Lynn manipulates Ali's abdominal muscles, which makes more room for the growing baby and will make her a little more comfortable. Lynn works to release tension in Ali's psoas muscle.
There's a couple of muscles that are particularly important in delivery, and that's the psoas muscle, which is like two great big strong muscles coming through the diaphragm down to the hips, and they're attached to all the lumbar vertebrae, all the low back vertebra, and to the lower two ribs. So if that psoas muscle is over tight, you're going to get low back problems, which could be a contributing factor to sciatica. And if that muscle's too tight in delivery, the baby's shoulders can't move around. As the head engages and the baby starts to turn through the pelvic canal, the shoulders can get stuck if that's too tight. And breathe in. And breathe out. And breathe in. And breathe out. Okay, if you put this hand on your sacrum for me, that's right at the base of the spine. A little bit more to the middle. The other thing that's important in pelvic mobility is the coccyx. And push in here. Lots of people forget that they've fallen on their coccyx. And when I'm examining them, I'll have a way of listening to their body, and the bodies talk, and the body says, I've been fallen on. And that's not good news for a delivery. You want a coccyx that opens nicely. I'm just going to work through your body and get a balance, and when the right time comes, I'll talk to baby, or baby will talk to me. If I don't say hello, then I'll get a kick.
I'll get the kick.
And push in here.
A full osteopathy session takes about an hour, and Lynn concentrates on those areas that are vital to assist a good birth.
Move through your spine while we're here. People don't usually come specifically for treatment as pregnancy treatment in the first trimester. They might in the second, due to getting a little uncomfortable postural wise. Third trimester is where I see a lot of people who come for the first time. Baby's not in the best position. So then I would work generally through the spine with the mother and the nervous system, stress system, whatever's necessary. Check that the kite's opening to see that the pelvis is opening nicely. If the baby's not in the best position, I don't go and move baby, but I work with the uterus and make space, so it creates a better environment for baby to take a best position.
So what are you doing now?
I'm just feeling for the movement of the uterus, just for any slight tensions there might be. It feels pretty good. There's just a slight pull down on the right. There's nothing abnormal, just we will have a bit of tension, so just to release that and makes a bit more space for baby. Sometimes you might find you grow a lot after this.
Oh no!
No, that's usually the first time we do this. People come back and they've grown a lot.
Finally, Lynn concentrates on Ali's baby and then checks on how her body has responded to the treatment.
feels a lot easier actually.
Yeah, it's moving a lot better. Bend to the side. Oh, that's better. On the other side.
For Ali, the results look promising.
I'm much
It
happier
was a
with that.
stiff old case before, wasn't I? It was very nice, very therapeutic. I do feel like I've been worked on very thoroughly. But I'm an awful lot more sort of liquidy. I think that's a good descriptive word. And I feel good. Yeah.
Do you feel your breathing's a lot easier?
An awful lot easier. Yeah, I feel I can move. That's what it is, because I think with pregnancy you get very stiff because you're holding yourself in a certain way. And I think when you get worked on like that, it just starts to release all the tensions and you just feel a little bit more as you would before pregnancy.